Did you know that sometimes when people get older, certain health problems can look like just aging, but they might actually be something dangerous like a stroke? That's why today's video matters. We're going to learn together how strokes can sometimes hide behind signs of aging and why spotting them early can save lives. Imagine your brain is like a busy city full of cars zooming down roads. Those cars are blood, carrying oxygen and energy. But what if suddenly a road gets blocked? Then cars pile up, traffic jams happen, and parts of the city can't work. That's what a stroke is. It's when blood flow to the brain is blocked. And the brain needs constant fuel to work properly. But here's the tricky part. Sometimes the signs of a stroke look just like someone is just getting older. Maybe they're tired, forgetful, or moving slowly. That's why we're learning about it today. Let's play a game. Aging or stroke? I'll give you an example and you guess which one it is. Number 1. Grandma suddenly can't smile evenly. Her mouth droops on one side. Is it aging and/or stroke? That's right. It's a stroke sign. Number 2. Grandpa forgets where he put his glasses. That can be normal aging. Number 3. Auntie's arm feels weak and she can't lift it. That's a stroke warning. So the big clue is that strokes happen suddenly. Aging happens slowly. Now let's learn a superhero trick to remember stroke signs. It's called the FAST test. F equals face. Can they smile? Or is one side drooping? A equals arm. Can they lift both arms? Or does one fall down? S equals speech. Can they talk clearly? Or are their words jumbled? T equals time. Call for help right away. Time is super important. If you see these signs in your parents, grandparents, or even a neighbor, don't wait. Tell an adult to call emergency services right away. In France, that's 15. Now you might wonder, why should kids learn about this? Because kids notice things adults sometimes miss. You see your grandparents every day. If they suddenly can't smile or their voice sounds funny, you might be the first one to notice. This is the reality for millions of families every year. Stroke is one of the leading causes of death and disability worldwide. The World Health Organization estimates that over 15 million people experience a stroke every single year. Out of those, around 5 million die, and another 5 million are left permanently disabled. That's a staggering number, and yet, so many strokes go unnoticed at first because their symptoms can mimic what we think of as normal aging. In this video, we're going to take a deep dive into this important topic, stroke symptoms that look just like aging. Over the next few hours, we'll unpack what a stroke really is, how to recognize it, why acting fast can save a life, and how lifestyle changes can dramatically reduce your risk. We'll also share real stories of stroke survivors who overcame incredible challenges. But first, let's understand exactly what a stroke is. In simple terms, a stroke happens when blood flow to part of the brain is interrupted. Without oxygen-rich blood, brain cells begin to die within minutes. Depending on which part of the brain is affected, the symptoms can look very different. Problems with speech, movement, vision, memory, or even personality. There are two main types of stroke. Ischemic stroke, which makes up about 85% of all cases, caused by a clot blocking a blood vessel. Hemorrhagic stroke, caused by a weakened blood vessel bursting and bleeding into the brain. Both are dangerous. Both can leave lasting damage. And both can disguise themselves as something we might brush off as just getting older. In the sections ahead, we're going to explore the symptoms that often fool us, the critical differences between stroke and normal aging, and most importantly, what you can do to protect yourself and the people you care about. So, let's start with the most confusing part. The common symptoms that make stroke look a lot like the everyday challenges of aging. Think about aging for a moment. We all expect some changes as the years go by. Maybe our memory isn't as sharp as it once was. Maybe our balance feels a little less steady, or our speech slows down just a bit. These gradual changes are normal, but here's the problem. Many early stroke symptoms overlap with those same changes. That overlap can cost us precious time. Key symptoms: memory problems, normal aging, forgetting where you left your keys, or occasionally struggling to recall a name. Stroke, sudden confusion, inability to understand simple instructions, or forgetting familiar people, places. Example: a grandfather suddenly can't remember his daughter's name, even though he knew it the day before. Vision changes. Normal aging, gradual need for reading glasses, difficulty adjusting to light. Stroke, sudden blurred or double vision, loss of vision in one eye, or loss of part of the visual field. Example: an older adult suddenly bumps into furniture on one side of the room because they can't see half their surroundings. Weakness or numbness. Normal aging, gradual muscle weakness, arthritis pain, or fatigue. Stroke, sudden numbness or paralysis, especially on one side of the body. Example: while sipping tea, an elderly woman suddenly drops her cup because her hand went weak without warning. Speech problems. Normal aging, slower speech pace, occasional difficulty finding the right word. Stroke, sudden slurred or incoherent speech, or complete inability to speak. Example: at a family gathering, a man starts speaking, but his words come out garbled, leaving everyone confused. Balance and coordination issues. Normal aging, gradual decline in steadiness, trouble with stairs. Stroke, sudden dizziness, loss of coordination, or difficulty walking. Example: a woman gets up from her chair and suddenly collapses because she has no balance. See the difference? Normal aging happens gradually. Stroke symptoms strike suddenly, often within seconds. And that's the biggest red flag. If something changes suddenly, whether it's memory, speech, movement, or vision, it's not just age, it's a medical emergency. Key differences between stroke symptoms and normal aging. Now that we've seen how stroke can disguise itself as aging, let's draw some clearer lines between the two. This comparison can save lives. Side-by-side examples. Memory, aging, takes a little longer to recall names but eventually remembers. Stroke, cannot recall names or places at all, even with reminders. Speech, aging, sometimes struggles to find the right word but can communicate. Stroke, suddenly slurs speech or speaks nonsense. Movement, aging, gradual stiffness, slower walking. Stroke, sudden inability to lift an arm or leg. Vision, aging, slowly worsening eyesight, needs glasses. Stroke, rapid, unexpected vision loss in one or both eyes. The golden rule is this: if symptoms are sudden, think stroke. Don't wait. Don't assume it's just age, because every minute that passes means more brain cells are lost. Risk factors for stroke and personal risk assessment. Every disease has risk factors, and stroke is no different. Some risks we can't change, but many we can. The key is to know where you stand. Non-modifiable risk factors. Age, risk doubles every decade after age 55. Family history, a parent, brother, or sister with stroke increases your risk. Gender, men have slightly higher risk at younger ages, while women face higher risks later in life. Modifiable risk factors, high blood pressure, the number one risk factor. Diabetes damages blood vessels over time. High cholesterol leads to clogged arteries. Smoking doubles the risk of stroke. Obesity and inactivity increase chances of high blood pressure and diabetes. Excessive alcohol use can raise blood pressure and weaken vessels. Emerging risk factors, stress and chronic anxiety. Poor sleep and sleep apnea. Unhealthy diets high in processed foods and salt. Take a moment, ask yourself, do I have high blood pressure? Do I smoke? Do I exercise enough? These aren't just questions for doctors, they're questions for you right now. On-screen activity. A checklist pops up with a scoring system, 1 point for each risk factor present. 0 to 2 equals low risk. 3 to 5 equals moderate risk. 6 plus equals high risk. If you scored high, don't panic. Knowledge is power. The fact that you know your risks means you can do something about them. And that brings us to the next critical point. What happens when stroke strikes, and why time is everything? Importance of timely medical attention and treatment. Picture this. A stroke is happening in the brain. Millions of neurons are dying, 2 million brain cells every single minute. That's why doctors say, time is brain. The faster you act, the better the outcome. Key points. Emergency treatment options. TPA, tissue plasminogen activator, can dissolve clots if given within 3 to 4.5 hours. Mechanical thrombectomy, a procedure to remove large clots, effective up to 24 hours in some cases. Why delays are deadly. Waiting reduces the chance of recovery, increases risk of disability, and can mean the difference between walking and being paralyzed for life. There are countless stories of lives saved because someone recognized the signs and called for help immediately. But there are just as many stories of lives forever changed because people waited, thinking it was just aging, just tiredness, or just nothing to worry about. The good news is that while treatment is vital in emergencies, prevention is even more powerful, and that's what we'll explore next: how to lower your risk and protect your brain for the future. Prevention strategies and lifestyle changes. Here's the truth: up to 80% of strokes are preventable. That means lifestyle changes can dramatically cut your risk. You have more control than you think. Strategies. Explained: control blood pressure, monitor regularly, take prescribed medications, reduce salt, manage diabetes, keep blood sugar in range with diet, exercise, and medication, eat a balanced diet, focus on fruits, vegetables, whole grains, fish, and healthy fats. Exercise regularly, at least 150 minutes of moderate activity each week. Quit smoking. Benefits begin within weeks of quitting. Limit alcohol. No more than 1 drink per day for women, 2 for men. Get regular checkups, annual screenings for cholesterol, blood sugar, and heart health. You don't need to overhaul your life overnight. Small steps add up. Replace soda with water. Take a 20-minute walk after dinner. Add 1 more vegetable to your plate. The key is consistency. Think of prevention as a gift to your future self: a stronger brain, a healthier body, and more time with the people you love. Real-life case studies of stroke survivors' statistics tell us the scale of the problem. Stories show us the human side. Let's meet some people who have lived through stroke and come out the other side with lessons for all of us. Case Study 1. Misdiagnosed as aging elderly man with repeated small strokes, TIAs, dismissed as senility. After proper diagnosis, lifestyle changes and medication prevented a major stroke. Lesson: never ignore sudden confusion or memory loss. Case Study 2. The middle-aged professional woman in her 50s ignored sudden weakness, blamed stress. Husband recognized FAST symptoms, called emergency. She received TPA within the window and made a near-full recovery. Lesson: quick action saves independence. Case Study 3. Rehabilitation journey. Man in his 60s suffered a large stroke, lost speech and mobility. Through rehab, relearned to walk and talk. Shares message of hope and resilience. These stories remind us, stroke is not the end of the story. With awareness, quick action, and the right support, survival and recovery are possible. We've covered a lot today: what stroke is, how it mimics aging, the critical differences, risk factors, prevention, treatment, and real stories of survival. The bottom line is simple: stroke can look like aging, but it isn't. When in doubt, remember FAST, face drooping, arm weakness, speech difficulty. Time to call emergency services. Don't wait, don't assume, take action. Now it's your turn. Share this knowledge, talk to your loved ones, encourage regular checkups. And if you ever see sudden changes in memory, speech, movement, or vision, don't dismiss it as aging. Call for help immediately. You could save a life. Thank you for watching, and let's work together to build a world with fewer strokes, stronger recoveries, and more years of healthy living.